Great honor, as always, to rise in this House representing the people of Timmins James Bay. To be here at a moment when our world has changed fundamentally forever, and that's the question that we need to come to terms with in this House, is that we are in the midst of an unprecedented economic and health crisis, and the role of Parliament coming together to find a way to establish a means of working to address the nature of the crisis. As I speak, we've just had a report that the Canadian military, who have been in the long-term care homes, have found blatant disregard for the lives of seniors, abuse and negligence in the for-profit care systems. And the people back home are looking to this Parliament and will look to us to say, what will you do to ensure this never happens again? Now we'll hear some say, well, that's under provincial jurisdiction. Well, the negligence happened under provincial jurisdiction in numerous jurisdictions. These seniors deserved better. And we're going to have to look at how we envision health care in the 21st century. COVID has exposed very clearly the myths of our society, the smugness. It has laid bare the inequities, and it has made us start to address this. So I think what we could say is that for Canada, we are now in the new century, and the old century and its old smug assertions are gone forever. So, yesterday the leader of the opposition was talking about the magical, mystical, hidden hand of the market that creates everything you need. That's a really bizarre thing to say when this nation didn't have PPE, and that we had our closest neighbors stealing our medical supplies in the United States, and that we had frontline medical workers having to do crowdsourcing because our nation didn't have the capacity to handle it. So people will look to this Parliament to say, what are you going to do to make sure that that never happens again? That we should never, ever be in a situation we have to send in the army to keep our seniors alive. We send in the army to earthquakes in Haiti. That's where we send in the army. We send them into catastrophic floods and fires. The fact that we had to send them in because we've left the health care for seniors so negligent that these reports are speaking of the blatant disregard and abuse. So we had to adjust how Parliament worked. And Mr. Speaker, I'll say one thing in opposition is you never give up time. It is your one tool. You never shorten debate. You never give up an opportunity to speak because it is the one tool you have. But in the face of the crisis, the recognition that we had to pull back from Parliament, we had to think about how we were going to do this. So for the New Democrats, we said, we're in a minority. We will begin to negotiate. That's what you do in a minority. So the first negotiation was on the fact that suddenly we had millions of Canadians who couldn't pay their rent. So much for this myth of the middle class and those wanting to join them. What we see are millions of people in the gig economy, millions of contract workers who were not going to get to April with ability to pay their rent. So we started to push the government, and the original talk was, well, they were going to tinker with the EI, and they had a little bit more for Canada child tax benefits, and we were saying the extent of this crisis is such that we have to do something extraordinarily different, something that's never even would have been thought impossible in February, a $2,000 a month base minimum to keep people afloat. And we worked with the government on that. We never got any support from the Conservatives. They were all howling, they were talking about the shirkers and people sleeping in their hammocks. We worked with the government, but then we said to the government, it's too restrictive, because what about the self-employed? We had to change it. So for each step of the way, we had to negotiate. And this is what you can do in a minority, Mr. Speaker, because if you look at the United States, they got a one-time payment of $12.50. No wonder there's so much social unrest in the United States right now, the breakdown of social solidarity. If there was a one-time payment of $12.50 in March, it would be an economic catastrophe for Canada. But we recognize we have the power with the federal government. It's a power that the federal government has that the provinces don't have, because we have the Bank of Canada to backstop this, that we could get $2,000 a month as a bare minimum. And so we got the self-employed involved. Now, in England, under Boris Johnson, they went with a base income as well. But they do not include the self-employed until June. If we had done the same thing in Canada, there would have been millions who would have been wiped out. So this is how we negotiated. We gave up the time that we fight for in trying to stop government from shutting down debate, the time that we fight for in our committee. We gave that up because there was a bigger principle at stake, which is the crisis that's facing Canadians. We came back and negotiated with them on small business, on the original plan the government had for 10% wage subsidy. We said a 10% wage subsidy isn't going to do it. It has to be 75%. And we negotiated that. That's what we do in a minority. We have the capacity. So when the government brought this motion in to move to 4 days a week for Committee of the Whole, and for people back home, you never heard Charlie Angus explain the ins and outs of how Parliament works, because I don't tend to. But the idea that this is a fake Parliament, not a real Parliament, that is a complete misrepresentation and falsehood. What we have been able to do is actually zero in with ministers, asking very specific questions to actually push much harder. So when we said, well, how long will we get to the end of June? We're not shutting down Parliament permanently. How do we get to the end of June? We said, well, two clear things for us. We wanted some sessions in the summer because we don't know how COVID will change in the summer. We heard nothing from the Conservatives about wanting to show up for work in the summer, nothing. Parliament doesn't sit in the summer. We got those meetings. But the other thing that we said, we will support the government on this key issue, is that we have workers who are going back with $14 an hour who have no sick time off. You never hear a Conservative stand up and talk about someone making $14 an hour, unless it's like, hey, I'd like to thank the guy who served me my burger this morning when I went through the drive-thru. Well, that's great that he thanked the guy at the burger, as I heard earlier, but they offered nothing for the fact that if they get sick, they can't take time off. So for the 10 days that we negotiated with the government, that is extraordinary. It's also extraordinary because we realize, and my friends in the Bloc will lose their minds on this, but that there are elements where we have to start talking at a federal level of how we do this across Canada in a pandemic, that we are going to have to negotiate a solution here. So we are now speaking till the end of June and where we need to be. But coming out of this, Mr. Speaker, we need to have a very, very clear vision that the economy is not simply going to turn itself back on, that it's going to roar back into life. You know, we had the leader of the opposition saying how we got to get government out of the way because we want people to be able to make choices. You know, Mr. 20th century man there, making choices when millions couldn't pay their rent. Let's get government out of the way. Let's just have the private sector do it all when we know when we're talking. Anybody who's dealing with industry is talking with industry after industry after industry who are saying we are not coming back without some kind of vision and support. So we're talking about what the role of government's going to be. You know, all these great, we've been here 2 days and we've heard about, let's see, they went on about Margaret Thatcher. Remember her? There was no such thing as society. Well, guess what? COVID showed that was not very credible. And then of course, they always do Winston Churchill. So we started off with Winston Churchill, we went to Margaret Thatcher, then they went to the Soviet Union, you know, the old fall of the Soviet Union. The only thing they were missing was that we had to hold the line in the Mekong Delta so that the dominoes didn't fall. You know, what we're hearing are the tired old excuses of a 20th century vision that doesn't cut it. And what COVID showed us in 2020 was that those old myths aren't going to cut it, that we're going to need a new vision for public investment in healthcare. To end the precarious nature of work, we're going to need a public commitment with standards, not just let's get government out of the way. And we're going to need a vision for building our economy. So we are willing as New Democrats to give up some of our time in order to negotiate in a minority to put the people of Canada first, and that's what we will continue to do. And we'll leave the Conservatives to howl at the moon and jump up on the back benches, and maybe they'll mention Castro next, or whatever else, other 20th century greatest hits of theirs. We will focus on what we need in this 21st century.